Hi guys, welcome back to the channel, and this is a very short video which I'm naming as a concept mantra, where we will be discussing very small things which we often get confused between. जैसे कि today's topic is clonic versus tonic, so let's dive right into it without wasting any much time. So whenever we get like focal tonic seizures, focal clonic seizures, we often get confused कि what means what. So this is a very sweet and short way to remember it. This is the best way you can remember it, and all your questions and all your doubts would get solved, and it would be a lot easier. So focal clonic seizures are basically repetitive and rhythmic contractions of the group of muscle. So basically, if it's a focal clonic seizure, it can be any sort of clonic seizure. There are many sorts of clonic seizure, but if, for example, if it's a focal, so focal means a particular area or a particular organ or a particular site. So if it's a focal clonic seizure, then there would be the two words you need to remember is repetitive and rhythmic contractions. So the contractions, what you'll be seeing is repetitive and rhythmic in a jerky movement. So that should be your clonic seizures. And what does it mean by focal tonic seizures? When you say tonic word, tonic means the tone, the tonicity of the muscle would be there. So it will show as a sustained posturing. I'm going to show you the images. So in case image based question comes up, it would be easy for you to figure it out. Which one is it, a tonic or a clonic one? So it could be that in case when we are talking about focal tonic seizure, the tonicity could be either like in the muscle part in single limb, if we are talking about focal, and it may be eye deviation. So it can be anything, but the posturing is there. The one word you need to remember to differentiate between these two things is sustained posturing. So let's go to the image now. This one is the tonic phase, where you can see the posturing is seen, the sustained posturing is seen, whereas in the clonic phase you can see the repetitive, like this is the image, this is not a GIF or anything, but you can like imagine yourself, or you can go and search a GIF of it as well, where you would see a repetitive movement or contraction of muscles. There is one more thing, the tonic-clonic seizure, where they use both of these things. There are phases of it. So in cases of tonic-clonic seizure, 10 Hz is tonic, 4 Hz is clonic, and post-ictal is shown. So basically, see, this image is what I wanted you to see, that stiffening or arching of the neck and the back, which is basically what we are talking about, the tonicity or the tonic phase or the tonic seizure part, where you can see the postural, this sustained posturing, and the jerking movement or the rhythmic jerking of limbs and contraction or repetitive movements is basically clonic. So basically this image was given, I just took it from Google, and you can search it as well, and this is just to make you understand the difference between the two things, so it helps you understand things better and make better concrete basics for your understanding. So thank you so much for watching. I'll be coming up more of this. If you want to follow me on Instagram, we have a page there, and we also post stuff there, so please go and follow there as well. The link you can find in the bio of the channel. Thank you so much.
Follow on Instagram for daily knowledge nuggets.